There are other points in the infection control procedures that are controversial. One of them is how long the patient should be isolated in contact isolation after the end of diarrhea. The guideline says 48 hours. That's okay, because after 48 hours there's no more diarrhea, no more risk for spread of spores in the environment, because there's no diarrhea. But the spore can survive up to 4 weeks after the end of diarrhea. So it's risky, could be risky in some settings where the patients are very sick, they have a lot of comorbidities, and just in case they acquire this infection, they can have a further risk for death, mortality. So I think that we should consider this measure, the 48 hours, very flexible, depending on which setting we are and which patient we are treating. In some cases, we should take in contact isolation for all the stay in the hospital. In some particular cases, maybe it is needed in order to avoid the spread to other patients. The second point that is controversial, according to my opinion, is the screening of asymptomatic carriers. A guideline says that asymptomatic carriers should not be screened, because otherwise we don't know what to do with them, and should we treat or should not we treat, should be put in contact isolation. This is costly, this is difficult to manage, but there are several studies that showed that in particular setting where there are immunocompromised patients, like bone marrow transplant patient or elderly people, long-term care facilities, screening of asymptomatic carriers was effective in reducing the rate of Clostridium difficile infection, in particular conditions like outbreak settings, and patients with high risk for Clostridium difficile infection. So again, we should be more flexible and to try to understand which patient should be screened when they are asymptomatic, of course, when they are admitted to the hospital, which patient and in which settings.